So I've been asked a number of times why I chose the University of Mississippi Family Medicine residency program. And for me, the number one reason has to be the clinical experience residents gain while they're here. The program offers an unopposed hospital service where we have the opportunity to care for some of the sickest patients in Mississippi, from the ER through to their workup on the floor, to their diagnosis, management, and then discharge. Residents have the opportunity to care for some really sick patients. And this experience really dovetails nicely with our continuity clinics. Our program has 2 of those clinics in the Jackson area where patients get to develop relationships with the residents, and the residents will care for those patients over the course of their 3 years. There are some complex cases. A lot of people don't seek the care as early as they maybe should have, and that really challenges the residents to gain the experience and the confidence they need to be successful after residency.
I chose UMC Family Medicine because of the location. Being in Jackson, Mississippi, you see a lot of pathology. A lot of people don't come to the doctor till they're very sick. So you get just a really good experience with a whole lot of different people, a whole lot of pathology, and I really wanted to be able to be exposed to that.
There's so many things about this program that I think they do that are really above and beyond what I would expect of any other program. So I know one of the things that a resident or like a medical student moving on to residency is really worried about is like, how are they going to measure up against everybody else? How are they going to learn everything to be proficient enough to feel really comfortable and just remain competent? And the great thing about this program is like, if you go to a lot of places, they're going to talk to you about how they have this open door policy. And if you have any problems, you can go up to them and you can ask and they can address it. But the thing is, and I mean, we do have this open door policy, but what's important about this program is that they really have a lot of steps to monitor your progress and how you're doing. So then before you find that you have issues, they might be able to address it and then help you out earlier before you might even realize it. And they do a lot of it like really discreetly. It's really nice the way that they do it. They're basically just offering more support.
The biggest thing is be ready. Be ready to learn, be ready to be busy. Residency is hard, and residency is hard no matter where you go. Here we try to make it at the learning as enjoyable as possible. We also try to get the residents to work as a team. However, what you need to do is be ready. If you don't understand a procedure, if you don't understand how to treat something such as diabetes or hypertension, be ready to learn that. Don't be afraid to ask. We would much rather you ask and get it right than not ask and get it wrong. But just be ready to learn.
36 months for you to learn how to be independent, competent, and capable. 36 months. And they will pass by in the blink of an eye. And so you have to approach every single opportunity as an opportunity to learn. You must be responsible for your learning and your education. We are responsible for creating the opportunity for you to be successful, but you own whether or not you are. And so as you go through these processes, as you have opportunities to rotate inside of cardiology and pulmonary and nephrology and inpatient and clinic, that all of those moments, all of those opportunities have been uniquely designed to create for you the substrate that you need to learn to be successful. You, however, get to choose whether or not you take advantage of those opportunities. And not all of them are fun. Not all of them are enjoyable. You should be tired at the end of an inpatient rotation. You should be exhausted, but you should be incredibly exhilarated from how much you've learned and grown. And so my encouragement to each of you as you sort of think about this path that lies in front of you is that this opportunity is yours to take advantage of, to sort of drive how much you want to learn and grow in this time. That while your teachers, your educators are responsible for creating the environment for you to be successful in, you, my friend, have the responsibility of actually taking that and creating the success that you want to see in your education.
So I think one of our program's strengths is the amount of clinic time that we get. I really like clinic, and clinic is what I wanted to do. So getting to be in here a lot, seeing a lot of patients, getting a lot of numbers, I really like that.
And then another thing that I think is just absolutely amazing is really just the resident community here. I don't know how, but somehow they're able to pick like 10 awesome residents every year. And it's just a bunch of people who are really fun to hang out with, so helpful. They'll be there when you need them, and then if you want time on your own, then they're good to give you your space. And it's such a great community, it's so much fun. There's no drama in the residency, there's no like little cliques that people belong to. It really just feels like a community. It feels like a family medicine, you know.
So my wife and I actually moved to Mississippi from Canada just 2 weeks after our son was born. And from the very beginning, everyone was so welcoming and so warm. That Southern hospitality that we hear so much about is truly a thing. We've, from the very beginning, felt so welcome. From the faculty to the nurses, to the staff, to the administrators, and even the patients. Everyone really does make you feel like you're part of the family here. They support you. When you need something, everyone will bend over backwards, and it's truly fantastic. I think that anyone will feel welcome at the University of Mississippi Family Medicine Residency program, and I do highly recommend it.